It's a very personal issue for me because I grew up without health insurance. My parents worked 4 to 5 to 6 jobs a week to make ends meet. They never had health insurance. Anytime I would go outside to play or anytime I would get sick, I knew what it would mean for the family. It would mean a trip to the emergency room. It would mean bills that we didn't expect. It would mean more stress on the family. When I was about in 9th grade, I ended up breaking an ankle and I went home. My dad had me ice it. And at the end of my icing it for 4 to 6 days, he said, you know what, why don't you try walking on it? And that's how we would tell if it was a serious injury or not. Of course, it was broken, so I went and I had to go to the emergency room and they had to put it in a cast. I don't think any parent should be forced to make that decision where they delay care or they watch their kid get sicker or get more seriously injured because they can't afford it. It's something that's always motivated me. That's why I got involved in working in healthcare issues. The Ways and Means Committee hearing that we just had was a big deal. We actually had a hearing on the idea of Medicare for all.
As long as I live, I will fight with every ounce of strength to make this right a reality.
This idea is gaining traction, and that traction will lead to legislative results and successes in the future. All big ideas are always met with skepticism.
We've heard that it would be about the worst thing to happen to the world since plague struck Egypt.
Eventually, people come to realize that this is about making sure that everybody understands that they will be taken care of. Just because of your color of your skin or the zip code you live in or the job you hold or you don't hold shouldn't impact or determine the outcomes of your health care. That, you know, just because you're a black woman, you're not going to have worse maternal mortality rates than a white woman.
It is not acceptable that in disease after disease, the African American community fares far worse than the white community.
Right now, there's still a large percentage that are not covered because they're undocumented or because they're moving from job to job. They don't have the stability, they're underemployed. These are the folks that would really benefit from a Medicare for All system. They try to say, yeah, that's crazy.
It's inconceivable.
And they try to say it's not doable.
It's inconceivable.
But eventually it does begin to stick. Medicare for All is a statement of values that we're all one country and that we all deserve to be healthy. That's what I think about Medicare for All.